Parents, if you have been told your teen's FND is all in her head, then you have been misled. The truth is this: FND is a real condition, but doctors often miss this key piece, which is the mind-body connection. In today's video, I will explain why FND is neither just psychological nor just medical. It is a disorder of the brain wiring, hence it is a neurological condition. And once you understand that, the real recovery becomes possible. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. I have helped countless teens overcome FND along with their parents. So if you're watching this video and are learning a lot about FND, let alone teen FND, then please hit the subscribe button and share this video with everyone who can think of, because trust me, this is going to help not only me, but increase awareness to help your teen recover from FND. So let's talk about today's video. Why doctors get this wrong. So let me tell you, I had this experience multiple times, and I work with a lot of pediatric neurologists and other medical providers. So I have massive respect for them. So this is not to just basically throw them under the bus. However, here's a reality. The medical doctors, especially conventional medical doctors, are basically educated that our body illness is either biological or psychological. It has been present for many years, and it is not their fault, but it is simply how they were being taught. Therefore, if they cannot see anything on the test, then it must be psychological. Therefore, it is all in your head. It's an infamous statement I hear all the time from teens who have been invalidated, hearing people telling them it is all in their head. It was a really blood-boiling moment. However, as a result, what happened is that the families are left with more confusion and frustration because no one can help them. What I would call it a blind leading a seriously blind. Would you agree? That is essentially what's happening with many families who are getting the diagnosis of FND. And so why the mind-body connection matters, let me tell you. Because here's the deal. Functional Neurological Disorder, short for FND, is a biopsychosocial phenomenon, aka it is a mind-body issue. So even if there is a lot of symptoms happening, including fainting, seizure-like symptoms, chronic pain, the teen's body is physiologically okay, even though it sucks and painful. It is real and they're not making things up. And however, there is no structural damage to their body. And this is why the conventional medicine, medication, surgery, more supplements, they don't work. They don't provide the solution. They might give a relief a little bit, but they are not the solution because you are chasing after the wrong target. So unfortunately, this is kind of hard to say, but cognitive behavior therapy, short for CBT, is a gold standard for treating functional neurological disorder, short for FND, including chronic pain. However, I have to say this, CBT itself is oftentimes not enough. So if you're being told by doctors, yep, your teen has an FND, so go see a CBT therapist. CBT. And I will say, as a licensed psychologist myself, CBT is a gold standard, and I have been trained on different types of CBTs. However, with FND, the therapy alone is not gonna fix this. You need a structured approach like the Brain for Teens methodology that I have in my online program, Teen FND Academy, or more robust approach rather than just one thing, which is the CBT, which is tapping into a part of what's happening with FND. Now, I'm not saying that you need to keep adding more to the table, like you need to see acupuncturist, physical therapist, occupational therapist, speech therapist, a therapist, and chiropractor, and shaman, and this supplement, and that supplement, and psychiatrist. I'm not saying you need to see all of those things. I have seen basically any combination or just singular program like what I'm doing, Teen FND Academy, to literally retrain the brain so that the teens are ready to send that right signals again. So I've seen it time and time again. Now, everybody's FND is different. That's why there is no one size fits all formula. Like Johnny here was seeing a psychologist, psychiatrist, and physical therapist, and occupational therapist, and yoga. So this was really working, and therefore Jenny over here needs to do the same thing. Not necessarily the case. Could it be helpful? Maybe, maybe not, right? So again, this is where it gets kind of complicated. However, just unfortunately, therapy itself alone is not going to fix this, because your teen needs a little bit more of this mind-body approach to retrain the brain and the body. So how can they do that? So here is exactly what I can tell you. Number one, in my online program, Teen FND Academy, I always start with this. Literally, the Brain for Teens methodology is a super simple way to retrain the brain and the body, and therefore the teens be done with FND. Starting with what, how, and the why of that process. So the what is literally you have to start with a solid understanding of what FND is. Like when I talk about FND is a biopsychosocial thing. So mind-body issue caused by so many layers of things. So it's not just one thing that is causing. And FND is curable. If you are believing that FND is something that is permanent, therefore I have to live like this or learn to cope with it, then you're going in that path, because you're basically wiring your brain and body a connection like this is something you're going to have to live with. However, if you believe that FND is curable, then you're on this path of retraining the brain, starting with teen having a sense of control and self-awareness. And this is exactly what I teach in my online program, Teen FND Academy. That's why parents are learning to start to sort of back off rather than hovering and then taking over the responsibility of caring for your teenage who needs more independence naturally and then developmentally. Number two, you have to have this strong belief system as a parent. The teens can get better. Once again, kind of repeating myself, but not just cope with it or learn to live with it. There's nothing wrong with it, actually. If you rather want to live with FND and there are some ups and downs, but yeah, I'm kind of coping with it and learning to live with it, there's absolutely nothing wrong with it if you feel this is the pathway you want to go. With Teen FND Academy, I am all about you can actually be done with FND and then get your life back. So that is the kind of families that I only work with. Therefore, strong belief system that teens can get better coming from both teens and the parents are absolutely necessary. And again, that also includes strong belief system that the parents are trusting their teens no matter what, not just only when it's convenient. So kind of like this, you have to lead with the mindset, right? So what that means is that if your parent saying, we're in as long as you're in, I totally get that. But if you're constantly waiting for the teen to have a buy-in and then 100% ready, then you might have to spend maybe next a year or 2 or 3 or 4 or 5, 10 years. And the question is, can you wait for that long? And if this is something that is unknowing but can live with it, sure, maybe this is a nice to have kind of problem. But the families that I work in my Teen FND Academy, no, this is a priority. This is like the bleeding neck problem that they need to treat this and then be done with FND like tomorrow, if not yesterday, right? So this is not something they can wait. Therefore, you have to have this strong belief system that they're going to make it work and they are ready to trust the teens 100% no matter what. Beyond that, how to retrain the brain for recovery is literally stuff I'm talking about all the time. The nervous system regulation strategies, the pacing, the movement, and among other things, right? So it's not just one thing that you can do that is all good. It also has to do with the doing the right thing with the right mindset. Then you make it complete. The good news is FND is not all in your teen's head. It can come from the brain to resolve the condition. However, it is not just in their head. The great news is that when parents are working with the teen who is struggling with FND, and especially in that environment that is supportive, understanding, and a really solution-oriented mindset, again, doing the right thing with the right mindset, then their recovery can be really exponential, like quickly and effectively as possible. Now, if you want the real recovery, not just symptom management, then you might qualify for my online program, Teen FND Academy, and maybe you are ready to work with me along with other families who are working really hard to get their lives back to normal. Thank you so much for watching this video, and I will see you in the next video.